Vaccination rollout that's far from perfect, a health department in the grips of a corruption probe against the man in charge. Tonight, Hospersa is questioning the appointment of Tourism Minister Mmamoloko Kubayi-Ngubane as acting health minister. It's also criticizing government for the slow pace of vaccinations. To discuss this, I'm joined by Kevin Halama, Hospersa's national spokesperson. Kevin, thanks for your time. We appreciate it. So you issued a statement today with several concerns. I'm going to start with the vaccines because that's the biggest issue here, isn't it? What do you reckon? Why is government getting this wrong?
Good evening, Shahan. Look, I think with the whole vaccine process that government has undergone is that we're not looking at all the various vaccine options that are out there. We have not really gone through the likes of Sputnik just to get an idea of whether it can be used in the South African market, as well as also the communication around it. I think there's also a lack of communication. I think earlier today we had reports that in the Free State there's not enough people that are registering for these vaccines. And that also goes back to the communication aspect of this entire campaign. So we fear, Shahan, that this vaccination program is not going according to plan, mainly because of the procurement as well as because of the communication that is done by the department.
And then outside of the procurement, even the vaccines we have here, you say this process of vaccination should be simplified. How so?
Yes, definitely, Shahan. Like, for instance, with the registration processes, there's been loopholes after loopholes with the registration processes where you find people skipping queues, where you find that also a lot of the healthcare workers that when they do register for this registration process, it takes time for them to get the SMSs that lead them to where they need to be vaccinated. So it's really becoming a bit of a mess in that the process from registering and towards going to the vaccination sites, that delay is time that we can't afford. We feel that there needs to be also a process whereby there are walk-ins where people can actually go into vaccine sites after registering, and then they'll be able to be assisted with the vaccinations.
What's your concerns about the acting health minister?
Our main concern, Shahan, is that the Department of Health at the moment, it really needs someone with medical expertise at the helm to drive the department out of the storm. We feel that the appointment of the acting tourism minister does not breed confidence into the health professionals that are there in the field. And that in itself, Shahan, is a slap in the face of health officials like us, who have been giving our all in this fight against COVID-19, that now at a time when we need someone with a pure leadership that has medical expertise, the president has decided to appoint someone that doesn't have the medical capabilities or the medical expertise to drive the department. That is our main concern, Shahan.
And then what do you think needs to happen regarding this? Because the president doesn't seem like he's going to have a new acting minister. The department, of course, is in the middle of a probe against the health minister himself. Would you say that the department is in a situation where it's unable to properly handle this pandemic?
Look, there are various options which I think that maybe the president could have looked at within his cabinet to ensure that there is a bit of stability within the department. I mean, there is the likes of Dr. Aaron Motsoaledi, who could have been appointed to act in the meantime while the minister is busy attending to the corruption allegations. We feel that that could have been a better option. The tourism sector in itself, Shahan, is quite a key sector in driving the economic activity of the country. Now, to have the tourism minister act in a health portfolio, that is in a way saying that you have one person looking after quite a huge portfolio in the economic of the country, as well as on the other side looking at the healthcare aspect of the rolling out of the vaccination campaign. So we definitely think that there are better options out there which the president could have looked at instead of appointing the tourism minister.
Yeah, and then lastly, of course, you say you have 60,000 members who are healthcare workers. What is their experience, any concerns of this third wave, if any?
I think that the main concern that we are getting from our members, Shahan, is mainly around the issue of vaccination. A lot of the members are raising concerns that they have registered for quite some time and they haven't received the vaccine, and now they are still on the front line providing the necessary health care to millions of South Africans while they themselves have still not been protected. I think that is one of the key complaints that we are getting from health workers, both in the private sector as well as in the public sector.
All right, thank you so much for your time. We appreciate it. That, of course, is Hospersa's national spokesperson, Kevin Halama.